Arundel Veterinary Surgery is a privately owned small animal practice that's been in existence for over 20 years at the northern end of the Gold Coast. We perform all the duties of a normal general practice, including vaccinations, desexing, grooming, consultations, all the things that every other practice does. However, we've extended into much higher levels of equipment and expertise, and have been told by many other vets that have visited the practice that we're the best equipped practice on the Gold Coast. We do high-end ultrasonography, video otoscopy, ECG, digital dental x-rays, endoscopy, chemotherapy, and have extended in the past 18 months to include laser therapy. This has become an important part of our general practice in terms of treating animals post-surgery, in treating arthritis cases, and also other numerous examples of where we use it to aid healing, reduce pain, and reduce inflammation in our patients. Well, we've had laser in our clinic for just over a year now, and what got me started on it was when I went to a conference, and they were, one of the stalls was selling this the K-Laser, and they tried it out on I have a small bone cyst there, and they lasered that, and within 2 minutes I was able to get more movement in that joint than I have done in goodness knows how many years. And was I impressed? Yes, I was impressed enough to see the possibilities in many walks of general practice, to the point where I actually bought two, one for each of our clinic. Like I say, we've had it for probably a year and a half now maybe, and arthritis cases, absolutely. We would typically do a course of 5 alternate days as before, and then we would evaluate, and then sometimes we will do a course of 5, let's say every 3 months. Other times we will do one a month. Sometimes we will do just one treatment every 2 or 3 months. It really does vary. And you normally find that owners are quite compliant here because they see the difference to how the dog or the cat is doing. For me, the biggest thing that I've noticed is in the clients that are able to reduce the dose rates of non-steroidals. So we may be able to go on to alternate day therapy at the time of surgery, for which we charge a fairly minimal fee, and that is purely for just to help wound healing over the incision site. So that is one thing. Post-operative orthopedic surgeries we use routinely now. I don't even give people the option of whether we do or we don't, because it just makes such a difference to the speed of healing. We will typically start that 2 or 3 days after the surgery, and then we will do a course of 5, and the anti-inflammatory effects. We've used it on dog fight wounds, other cuts, and we've now started using it on ear cases, and we've had 2 cases recently which were being head off to the specialist centre to have surgery on, and unbelievably we have made such a difference that surgery is not even being considered as an option. So it's making a big difference clinically. Does it make a difference to our clinic financially? Yes, it does. Nurses getting involved in it, so it's giving them something extra to do. So yes, very, very happy with it. The most amazing case is one of our ear cases, actually, that this particular dog had problems with his ears for years, and when we examined the dog, you could not get the scope down the ears. We admitted the dog, we did culture sensitivity, we did a general anaesthetic ear clean using our video otoscope and such. Did we put it on medications? Absolutely. But the big difference was when we started using the laser on it, and the improvements over 4 or 5 lasers was astonishing, because we do a lot of ear cleans here, so we're used to the sort of improvement you get having done proper ear cleans. But the difference was amazing, and at the end of the course of, I think it was 4 or 5 we did on this particular dog, you could get the scope down the ear, you could see right down to the base of the ear, The dog wasn't in pain when we were putting the scope down, which is a big thing that the owner noticed, and the end result of that case is the dog is better. Laser therapy, I would not be without it in general practice, and when I sell the practices, I'm keeping one of the lasers for myself, for my retirement.